Hello, my name is Dr. Bird Gilmartin. I am a general pediatrician and the pediatrician and medical director for the Kids in Care Settings, or KICS clinic.
Hi, my name is Dr. Jessica Kinney. I am a psychologist and the clinical director of the KICS clinic.
The concept and development of what is now the KICS clinic started in November of 2021, and the clinic opened to its first patients in May of 2023. We had the great fortune of talking to leaders in foster care health across the nation, learning from key partners such as youth involved in child welfare, parents whose children are involved with child welfare, foster families, kinship families, County Department of Human Services. And there was an incredible synergy of priorities and needs identified, specifically trauma-informed care, mental and behavioral health access and resources, a one-stop shop, lack of judgment and understanding, and knowledge of the various systems involved. We use these themes to guide us in the development of the KICS clinic. The clinic is starting as a pilot, a proof of concept with 1/2 day a week. Jessica will help answer, so what is KICS exactly?
So KICS is a medical home for children involved in out-of-home placement, meaning kinship or foster care. The medical home is a model or a philosophy of primary care that is patient-centered, comprehensive, team-based, coordinated, accessible, and has a focus on quality and safety. We have integrated behavioral health in the medical primary care clinic visits, which we know is the gold standard for addressing population-based mental health needs, and really allows us to shift the culture on how we think about behavioral health, and also allows us to treat the full spectrum of behavioral health, including both family and child needs whenever and however needs arise. Beyond this integration, our team is very multidisciplinary in nature, including a pediatrician and psychologist, and also a social worker, a nurse care coordinator, behavioral health navigator, community health navigator, dedicated child life specialists, close relationship with a developmental pediatrician, and dedicated medical assistants and schedulers. Beyond our integrated team, we have a really close relationship with dentistry, where they hold same-day slots for KICS kids who have urgent dental needs the same day as their KICS clinic visit. We are housed in the Child Health Clinic at Children's Hospital, Colorado, and we give all of the same universal screeners as the Child Health Clinic does, including screening for social determinants of health, young child development and autism screening, postpartum depression, caregiver behavioral health, and adolescent depression. KICS also universally screens for adolescent anxiety and substance use, as well as trauma symptoms in kids age 6 and up. Universal screening is another big way to address population health needs and work towards equitable and high quality care. The KICS clinic has longer visit times than regular primary care visits, and we employ a trauma-informed model and workforce with regular trauma-informed care meetings with all of the team members that I just mentioned.
So as of 2020, there were approximately 8,000 children in out-of-home placement in Colorado. And so when we think about why does this population, kids that are in out-of-home placement, need a specialized healthcare clinic? And to start, the American Academy of Pediatrics has designated patients that are child welfare involved as having special healthcare needs and being a special healthcare population. And we can point to numerous reasons, outcomes, and trajectories across life categories that even when we correct for income and other adversities, this population faces greater disparities and inequities. So for instance, there is a 42% increase in mortality for children in foster care versus the general population. Youth in foster care use outpatient and inpatient mental health services 20 times that of other children in poverty. And approximately 60% of children under the age of 5 that are child welfare involved have developmental health concerns. The list of adversity goes on from there. And what we see and what we know is that there's almost nothing that this singular experience does not touch.
Getting this clinic off the ground has been a tremendous effort and certainly has not been easy, but we have been continually guided by our values. The first is access to high quality care. Integrated primary care is all about providing the right service at the right time in the right setting and believing that every single person should receive this type of care, and especially for those who have the greatest need and who are least likely to receive access to high quality care as our current system is set up. Equity and justice, there are so many disparities in health inequities in child welfare, and to us, this means acknowledging the racism and oppression and systemic and individual injustices that our families have likely experienced, and then actively working every day to combat those within ourselves and during each clinic-based process to strive towards equitable and just care for our patients and families. And being trauma-informed, which I briefly mentioned before. This is a way of being and of structuring our clinic and practice where we move from thinking about and asking our patients and families, what's wrong with you, to what happened to you, and knowing that every single person has experienced some sort of adversity, and thinking about how we can provide corrective experiences to first do no harm, and second, hopefully be a part of a healing process within the context of the family's relationship with the clinic and our providers, from the schedulers to the medical assistants to Bird myself.
As we look towards the future for KICS, there are 4 main priority areas at this time. The first one is expansion, and this refers to numerous areas of opportunity: sustainable funding for the clinic, expanded dedicated time for team members, population expansion, a broadening of resources we can provide, such as in-house trauma services, and an ability to provide specialized care to more remote areas through consultative services. Secondly, we are continuing to work on evaluation and process improvement tools so that we can demonstrate the outcomes of the KICS clinic. We have a strong commitment to have ongoing, meaningful involvement of people with lived experience incorporated into the KICS clinic. And lastly, figuring out a diverse and reaching dissemination and education plan. Thank you for your interest and learning more about the KICS clinic.